Good morning, everyone. Welcome to the webinar. Today, I'm joined by my friend and colleague, Todd Taylor of GeoBlue, the division of Anthem. GeoBlue Travel Health Insurance is the name of the game. I'm going to roll through a few slides on my side, then we'll kick it over to Todd. And on the call with me is Eric Pouncey Jr. And he and I run the individual department here at Cornerstone. If you have any questions, give us a call, whether it be GeoBlue related or on the individual medical side, dental, vision, give us a call. Thanks so much. And then earn up to $7,000 with Cornerstone's cash incentive program. Earn more when you sell more for all group and individual new business sales between January 1st and December 31st. This will bring you closer to a $7,000 cash prize. Next, pilot your business and we will be your flight crew. The agency services program is designed to help you plan for your business, your clients, your family, no matter the situation. Among the services provided in ASP are the autopilot client referral program, parachute succession planning, and the flight plan retirement assistance. Check it out on our website. Okay, and we're about to kick it off with Todd. And as you go along, please put your questions in the chat box. We'll try to wrap things up by 9:55 today, and so get those questions ready so we can do Q&A at the end of this. And with that, I'm going to kick it to Todd.
All right, thanks so much, and appreciate the opportunity this morning. There's no better time really to get this product either out there for the first time or reacquaint your products with it. The airports are packed, your clients are traveling. There's a lot of pent-up demand, especially for international travel, and especially during the pandemic where people were literally locked up for almost 2 years. And make sure they are traveling with a product like GeoBlue, $0 deductible, $1 million medical limit, primary payer of claims abroad. Don't let it be your client that comes back to you that says, why didn't you tell me my Medicare product only covered $50,000 lifetime? Why didn't you tell me my ACA plan didn't cover anything internationally? Why didn't you tell me my corporate group plan had a $5,000 deductible internationally? Have something like GeoBlue that gives your customers and you yourselves peace of mind. Here's my contact information. I'll give you my broker support contact information as well at the end. Again, my name's Todd Taylor. I've been with GeoBlue really since the inception of the company. I've been working with Cornerstone for quite some time on this product and getting out there to the broker community. For those of you not familiar with GeoBlue, we are the international division of all the Blue Cross Blue Shield companies. We work with every Blue plan, specifically Anthem in your neck of the woods, to really strategize how best to get this product out there to the agent and broker community. If it's an international solution, GeoBlue likely has a product for that. As I sort of touched on in the previous slide, it's a common fallacy that your domestic plan will cover you just as well internationally as it would domestically, and that just oftentimes is not the case, and many times that can lead to a disastrous situation for either you or your client. ACA plans have very little to no international coverage. Medicare product supplement is $50,000 lifetime internationally. It's 80%. There's a deductible of $250 with that. There's no direct pay. And then a corporate group plan will cover you generally with what it covers domestically. So if you have a $5,000 deductible domestically, you will have that same deductible internationally, subject to the same deductibles, copays, and co-insurances. With GeoBlue, you can have direct billing, $0 deductible, $1 million medical limit, and access to all of our tools and services that I will talk about in a second. Seniors, can't stress this enough. We had a senior that went abroad just on Medicare. They needed an evac. They didn't have something like GeoBlue. They ran out of that $50,000 pretty darn quick. They had to set up a GoFundMe. They had to max out the credit cards, remortgage the house. Don't let that be your client, okay? GeoBlue plans are guaranteed issue up to age 95. Almost all of these plans can be sold online. This is another Blue Cross Blue Shield product to sell, and you can also sell these to your non-Blue Cross Blue Shield customers. You do not need to be a Blue Cross Blue Shield member to buy GeoBlue, and we have great pricing points for seniors. GeoBlue also covers the major drivers of international health claims. Number one is medical evacuation. Average medical evacuation can cost anywhere between $30,000 to $50,000. I saw one that was well over $250,000 one time. This service, is covered under all GeoBlue plans, as well as repatriation of remains. If you have a client that passes away overseas, getting those remains back is very complicated. There's a lot of paperwork involved. It's also very expensive. This is a service that is also covered under GeoBlue. Medical evacuation, repatriation remains are generally not covered under any sort of domestic health plan. They are both covered under GeoBlue. GeoBlue can arrange, coordinate, and pay for both a medical evacuation and a repatriation of remains. The pandemic, obviously, as you can imagine, decimated the international travel markets. There was a 95% reduction in international air travel. But as we hopefully are exiting the pandemic in some way where the deaths are coming down, the cases are rather static, I think it will provide opportunity and the absorption will go up. Honestly, I don't know anyone that's going to travel overseas now without thinking about having something like GeoBlue or a competitor product. And the data shows that people are much more concerned now about getting sick overseas due to the pandemic. So again, I think the opportunity and the absorption are going to go up dramatically. And all GeoBlue plans do cover COVID. Think of GeoBlue not just as an international health insurance policy, obviously that's what it is, but it's also a technology policy as well. You can arrange direct pay through our international PPO network, drug equivalency guide. If you have a client on a medication, they don't always translate the same. You can put into the GeoBlue app exactly what your medication is, and it will translate from, Japan to Italy to Germany, what that medication is. Translation of medical terms. If you end up in a facility where no one speaks English, you can put into the GeoBlue app exactly what you're trying to say. I think I have COVID, I have a stomach ache, I got stung by a bee, and it will translate accordingly. Understanding your health and security risks. We have membership right now in the Ukraine. We have membership right now in Russia, and we're giving them just as good a service as our membership anywhere else, and giving them real-time security information about what's going on block by block, street by street. Mobile ID card right from your smartphone. And then e-claims as well. If you have a relatively low dollar claim, you don't want to take advantage of the direct pay, you just want to pay for it then and there, you can take a picture of your claim. You don't need to translate it. And then you can file it through your smartphone. You're probably reimbursed by the time you get home. Again, all of this is ancillary to having a GeoBlue plan for an affordable premium. Also, as of last year, we were able to add a telemedicine service called Global Telemed. This is for free when purchasing a GeoBlue plan, no additional premium. If you're in an area maybe where COVID is still prevalent, or you're in the Ukraine, you don't want to go outside for obvious reasons, you can connect with a doctor through Global Telemed 24/7, and it will connect you with a physician accordingly through a video consult. This is available again on all of our GeoBlue individual plans. All right, here's the most important part. Let's get into the products. What can you sell? Where can you sell? How do you market these? Who are these products for? We'll start from the left. This is our GeoBlue Voyager plan. This is the most popular product sold by Cornerstone agents. It's the most popular product sold nationwide through all of our plans. It is a single trip plan, and it's for any US citizen who is traveling abroad from 1 to 182 days. It's guaranteed issue up to age 95. It's guaranteed issue from 1 to 182 days. So for example, you're going to Aruba for a week. You can buy and sell it for a week. You're going to backpack through Europe for a month. You can sell it for a month. Maybe you have a senior going on a Mediterranean cruise for 3 weeks. You can sell it for 3 weeks, up to 182 days, up to age 95. Any US citizen can purchase this plan. You do not need to be a Blue Cross Blue Shield member to purchase GeoBlue. This plan covers accidents, injuries, and illnesses abroad. If you have a stomach ache, it's covered 100%. If you have COVID, that's covered 100%. If you break your leg in a car accident, as long as you didn't steal the car, that is covered at 100%. No excluded countries. The plan will also cover most pre-existing conditions if you have a primary major medical plan in the US. That can be an ACA plan, a Medicare product, or an employer group plan. If you have one of those, we will cover most pre-existing conditions abroad. If you do not have one of them, if you have Medicaid or TRICARE or uninsured, you can still purchase the product. We just don't cover pre-existing conditions on those individuals. That would be our Voyager Essential Plan. All these plans, as I said, cover EVAC, they all cover repat, they all cover COVID, and all give access to our tools and services. The premiums on the Voyager plan are based on age and length of trip. If you're 18 years old going on spring break to Mexico, you'll probably pay $1 a day. If you are 94 going to Europe for 3 months, you'll probably pay $25 a day, roughly. Average premium on this is $100 per trip. Very affordable, high degree of value. Second product is our Trekker plan. This is a multi-trip plan. So the first one was a single trip. This is now a multi-trip. It's an annual plan. You buy it one time. It's good for the whole year. It will cover unlimited trips. So for example, if you are working maybe with a small group and you have a couple executives in that small group that are traveling back and forth between, let's say, the Dominican Republic, they're going back and forth or setting up a plant there or something. They can each do a multi-trip plan. They can go back and forth as much as they want without having to purchase it each time. It's also guaranteed to issue up to age 95, very affordable premiums, around $300 for the entire year. Also good for your senior population because as the rates go up, for seniors on the Voyager plan, they remain pretty static on the multi-trip. So seniors, they purchase it one time, they can go on as many trips as they want. No trip can be longer than 70 days, however. So we cover the single trip, the multi-trip. Third product is our Explorer plan. This is a comprehensive major medical plan designed for someone living overseas full-time. Full-time is 6 months or more. If you have someone living overseas 6 months or more, they are termed by the US tax code as an expatriate. You may have heard that term before. It's also good for a foreign national who's coming to the United States to work 6 months or more. If they're working here 6 months or more, they're termed an inpatriate, expatriate and inpatriate. This plan is good for either of those. Comprehensive major medical plan covers inside the United States under the National Blue Card PPO, and then outside the United States with GeoBlue, unlimited lifetime maximum, includes therapies, mental health, much more amplified inpatient care, physical therapy. The other major difference, though, on this, besides the benefits being more comprehensive, is the fact that there is a traditional medical underwriting component to this product as an individual plan. There's a series of health questions, and then based on how someone answers those questions, you can be rated as is, you can be rated up for a particular condition, you can in fact be declined. There's only roughly a 3 to 4% decline rate, though, which is great. And then the last product is our Navigator plan. And this is designed for 3 subsets of individuals doing long-term assignments. Number one is the marine crew market. Probably won't really come up at all, but that being said, I have a broker in Indiana that does a lot of business in Florida, and he does have people that work on boats, so that can be an opportunity. Missionaries, if you have a long-term mission client, maybe that's going to Latin America for 6 months or more, that's an opportunity. But then international students is where I see most of the benefit of this product here. So if you have a client that says, my kid is going to Barcelona for a grad program, he's going to be there for 2 years, Navigator plan will give them access to Blue Card here in the US and then overseas with GeoBlue. It can also work inbound as well. You have a foreign student coming to Cincinnati maybe to study here 3 months or more. That's an opportunity as well. So and students get expedited underwriting, which is only 5 questions. Students, missionaries, mariners, expatriates, inpatriates, senior travelers, business travelers, leisure travelers, all opportunities with GeoBlue that you may not have thought of before. In fact, any one of your clients or yourselves or your relatives or your friends or your neighbors that are traveling abroad is an opportunity for GeoBlue. Recognizing opportunities real quick, just so we leave time for questions here. Just as I said, anyone's an opportunity going abroad. 19-year-old student going to Greece, $0 deductible, $1 million medical limit, $200 for the entire trip. 45-year-old business person, maybe part of a small group going back and forth from Germany, 175 for the entire year. 68-year-old, if you have senior clients, don't let them go abroad with just Medicare. I'm telling you, it could be an absolute disaster for them. $81 for the entire trip, and then maybe you have a senior taking 3 international trips. $460 for the entire year. I get a lot of questions about cruises. International cruises are not excluded as long as they are an international cruise. Case study here, just so we are making sense of everything and everyone really understands the value of this product. The premiums may seem low, but they provide an extremely high degree of value. This was a young lady who got herself into a very severe car accident abroad. She was doing a study abroad trip in Australia. She took an excursion to Lombok, Indonesia. She had a very severe open leg fracture, and they were very concerned about blood supply issues in Indonesia. They did not want to do a surgery there. So we arranged for an air ambulance evacuation to Singapore. Air ambulances are very expensive. There's no IOUs in them. You either have to have a credit card, cash, or a supplement like GeoBlue to pay the vendor directly. You can't just say, do it and I'll pay you later. So that's, again, the value of GeoBlue. We have relationships with air ambulance companies, and we can arrange them quickly to get our patients out. So this young lady was brought to Singapore, Mount St. Elizabeth Hospital, one of the best hospitals in Asia. She had the procedure and she recuperated, I believe, for 4 or 5 days. And then she actually was able to continue her trip back in Australia. We arranged for physical therapy for her there, and she was able to just continue on her trip, which was the best possible outcome. Look at the costs involved here. Almost $12,000 for the medical services, $25,000 just for the air ambulance alone that had to be paid directly. Travel arrangements, and then a bedside visit benefit. All of our plans do include a bedside visit benefit for a loved one to visit if you are expected to be in the hospital for 7 days or more. $39,000, little over $39,000 in costs. Every penny direct billed to GeoBlue. She had a premium of $190 for her entire trip. $190 for her entire trip, okay? Relatively low premium, high degree of value. She had a $0 deductible, $1 million medical limit, GeoBlue, primary, and claims. Getting appointed to sell this product is super simple. You just go to geobluetravelinsurance.com/cornerstone. geobluetravelinsurance.com/cornerstone. You can get appointed today. It takes 2 minutes. It's not like a traditional U.S. appointment where you're having to file E&O and things like that. It's more of an agreement than an appointment. geobluetravelinsurance.com/cornerstone. Once you're appointed, you will get a coded URL, a coded link in your welcome email, and that is how you sell the product. You can blast that link out to your clients. You can put it on your agency website, like a travel medical area. You can put it in on social media, your email signature. The more you get that link out there, the easier, the more sales you will get, and it doesn't really cost a lot of hard dollars to market a product like this. geobluetravelinsurance.com/cornerstone. Quoting the product, again, very easy. We try to make this as easy as possible. You put in a zip code, you put in the dates of your trip, you put in the age of your client. If you have more people as part of a family, you click Add Traveler. Once you have the demographic details in there, you click Quote Now. The price you see on the right, that's the price of the whole trip. Okay, you have a series of medical limits you can toggle back and forth from. It'll automatically default to $1 million medical limit, 0 deductible. You can toggle back and forth. My family's not worth $1 million. We'll do $50,000, and then you have deductible options as well. Once you have the pricing point that you want, you click Apply Now. You put in a credit card. You're off to the races. Your client will get a confirmation email and an ID card, a GeoBlue ID card, and then you as the agent will also get a confirmation email. Agent Hub, you also gain access to a GeoBlue Agent Hub. You can download marketing materials, track your sales, track your commissions. Commissions will come from GeoBlue directly, and you can also quote from this as well. Please take advantage of our marketing materials. There's a lot of great stuff in here. Again, it does not cost a lot of money to market GeoBlue. We have email templates that you can download that have your link already embedded in there. So all you literally have to do is just blast it out. We have newsletters, we have social media posts. Again, you can download, the link's already in there, and you can just blast it out. We have banner ads as well. Please take advantage of all of that. Here is my team's contact details. If you have questions, you can reach out to me, you can reach out to my team. We're more than happy to help. I'll leave this up for a little bit more, and
Yeah.
I'm more than happy to answer any questions.
Okay, great. Thanks, Todd. We have just a few minutes for questions, and by all means, put those in the question box. First question, is this available in the US for those who have ACA plans?
It is not. So that is how we don't compete with our domestic Blue Plan partners. So GeoBlue is an international policy. Now, the long-term plans do have US coverage, but you have to have some sort of international component to that, right? You have to be an expat, an impat, a student, a mariner, or a missionary.
Okay. All right. So far, that's the only question that's come up, but I did have a question for you, and we were discussing this in the office the other day. We had a client that was diving deep into their ACA evidence of coverage, and lo and behold, they saw something out there for foreign coverage, and I kind of, you know, paused at that. Can you touch on that a little bit?
Right. So yeah, listen, in an average ACA plan, or most ACA plans that I've seen, and I've looked at the certificates, there's generally no international coverage at all. Now, that's not to say that every ACA plan is that way. But that being said, even if there were some international coverage as part of an ACA plan, it definitely doesn't have access to all of these benefits. It won't have direct pay. It's not going to have a drug equivalency guide. It's not going to have translation services, or you're not going to get an international ID card or e-claims. How that would work is you're going to have to pay out of pocket, and then you're going to have to file with the ACA plan. You're probably going to have to translate your claim. What if you need an evac? It's not going to arrange an evac or a repat. So you have to look into all of those sort of situations, and it's definitely not going to have a telemedicine service. So you got to look at it holistically, would be my suggestion on that.
Yeah, great. The questions are just flooding in. We do have a hard stop right at 9:58 or so.
Okay.
So I'll try to breeze through these as much as I can. If I wanted to do a seminar on this product, is one available in agency resources?
Is that a question for me? I guess I'm not sure what agency.
Yeah. Is there a seminar, like a prepackaged seminar that they could do?
I think we could probably figure out something where, if we don't necessarily do seminars, but that's not to say we can't do a seminar. Probably something I'd have to look at more offline.
Okay, yeah, absolutely. So Rochelle, if you'll just shoot me an email, I'll get that over to Todd, and we can discuss. Another question, where do we get digital flyers for these products?
When you become appointed, again, let me get to that appointment slide again right here, GeoBlueTravelInsurance.com/Cornerstone. There's an entire marketing area. You can download flyers, brochures, the banner ads, the email templates. It's all in there.
Okay. When will there be a plan available for foreigners visiting the U.S.?
Good question. We're working on that right now. So we should have a visitor product. It will likely be under our HTH brand. We have two brands. We have GeoBlue and HTH Worldwide. The Blues, don't necessarily do visitor insurance, so that's why we're putting it on our off brand. Likely, I'm really hoping by the end of the year to have a visitor product.
Would this extend to over 65 as well?
Yes.
Okay. More and more, I'm seeing that as a trend. Get questions on that just about every week. Lastly, is there any plans that cover people traveling with insurance that are unable to get coverage out of state? I think this is a domestic question.
No, it's not a domestic health plan. When GeoBlue was created, there was a lot of questions over that, and just we can't compete with a local blue plan, so that's why we don't sell domestically. But yeah, I mean, this is something that comes up all the time. People with like an HMO or an ACA plan with, you know, strict networks traveling overseas, it would be a great product. You know, but it's not something we have as of yet.
Okay, that's great. What a fantastic presentation. And if you have questions, additional questions, just shoot them over to me and I'll get those over to Todd. By all means, reach out to Eric and myself about getting appointed. You can also go to that link there that he's got on the screen there, and we'll get you set. Everybody, have a great day. We'll talk to you soon. Thanks, Todd.
Take care. Thank you.